Hello friends, welcome to Expert Medical Coding. In today's video, we are going to learn about GI bleeding. We are going to see what is GI bleeding is, types of GI bleeding, symptoms, causes, complications, test, treatment and prevention. So let's get started. What is GI bleeding? GI bleeding is actually a symptom of a disease rather than a disease itself. It can occur anywhere in the digestive tract, which includes the upper and lower GI tracts. The upper GI tract is composed of the esophagus, stomach, and first part of the small intestine, that is, duodenum. The lower GI tract includes the latter part of the small intestine, large intestine, rectum, and anus. Now let us see the types of GI bleeding. Acute GI bleeding. Sudden, severe bleeding that's a sign of a medical emergency. Chronic GI bleeding. Bleeding that comes and goes over a long time. Occult GI bleeding. Bleeding is not visible as it is microscopic, but you can see signs of GI blood loss such as low blood counts on laboratory testing. Overt GI bleeding. Visible signs of a GI bleed including abnormal colors or substances in your feces. You may also vomit blood. Obscure GI bleeding. When standard endoscopy testing does not reveal a source of GI bleeding. Now let us see the symptoms of GI bleeding. And they are black or tarry stool, bright red blood in vomit, cramps in the abdomen, dark or bright red blood mixed with stool, dizziness or faintness, feeling tired, paleness, shortness of breath, vomit that looks like coffee ground, weakness, anemia, dehydration, fever, and low blood pressure. Now let us discuss about the causes of upper GI bleeding. Causes of upper GI bleeding can include peptic ulcer, tears in the lining of the esophagus called as Mallory-Weiss tear, enlarged veins in the esophagus called esophageal varices, portal hypertensive gastropathy, esophagitis that is inflammation of the esophagus, abnormal blood vessels, hiatal hernia, cancerous or non-cancerous growths in the upper digestive tract, gastritis, duodenitis, GERD with esophagitis, stomach cancer, and esophageal cancer. Now let us see the causes of lower GI bleeding. Causes of lower GI bleeding can include diverticular disease, inflammatory bowel diseases, proctitis that is inflammation of the lining of the rectum, colon polyps, hemorrhoids, anal fissures, anal cancers, colorectal cancer, ulcerative colitis, infectious colitis, rectal ulcers, rectal varices, and angiodysplasia. Now let us discuss about complications of GI bleeding. The first complication is the anemia. Prolonged bleeding can lead to a lack of hemoglobin and red blood cells causing anemia. Next complication is the hypovolemia. In cases of severe blood loss due to an acute GI bleed, a person's heart may have difficulty pumping enough blood throughout the body. Next complication is the shock. GI bleeding that comes on quickly and progress rapidly can lead to a lack of blood flow to the rest of the body, damaging organs and causing organ failure. Now let us discuss about the test of GI bleeding. The first test is the blood test. Blood test will be done to check for signs of GI bleeds such as anemia. Fecal occult blood test. This is a lab test that checks for signs of a blood in a poop sample. Nasogastric lavage. A tube is passed through your nose into the stomach to remove stomach contents. This might help find the source of the bleeding. GI X-rays. GI X-rays take images of your upper or lower digestive tract to check for signs of a bleed or other conditions. The test uses a barium contrast solution that makes it easier to see the digestive tract on the X-ray. Upper endoscopy. Upper endoscopy is a procedure to examine symptoms of an upper GI bleed. It uses a long tube with a camera and light at the tip. Capsule endoscopy. In this, you swallow a vitamin-sized capsule with a tiny camera inside. The capsule travels through your digestive tract, taking thousands of pictures that are sent to a recorder you wear on a belt around your waist. Colonoscopy or sigmoidoscopy. This is a procedure to examine signs of a lower GI bleed. The test uses endoscopes that are passed through the anus. CT scan. CT can aid in identifying the location and cause of bleeding. Colonoscopy. A long flexible tube is inserted into the rectum. A tiny video camera at the tip of the tube allows the doctor to view the inside of the entire large intestine and rectum. Angiography. A contrast dye is injected into an artery and a series of X-rays are taken to look for and read bleeding vessels or other issues. Balloon enteroscopy. This is like an endoscopy. It uses long tubes and a camera. Tiny balloons at the endoscope tip inflate to help provider examine hard to reach small bowel. Now let us discuss about the treatment of GI bleeding. Medications. Medications can treat some bleeds, including ones due to ulcers, hemorrhoids, or GERD. Medications will be given to reduce levels of stomach acid, help your blood clot, and relieve swelling. Procedures. In many cases, healthcare providers deliver GI bleed treatments during an endoscopy or colonoscopy. Tiny instruments at the tip of the endoscope or colonoscope make it possible to remove abnormal growths such as colon polyps, inject medications that help the body stop bleeding, seal abnormal blood vessels with a tiny band or clip, use low levels of a laser or a hot or cold gas to destroy the tissue causing the bleeding. Depending on the amount of blood loss and whether you continue to bleed, you might need IV fluids through a needle and possibly blood transfusions. When a person has severe acute bleeding or bleeding that does not stop, a surgeon may need to perform a laparoscopy or laparotomy to stop the bleeding. Now let us discuss about the prevention of GI bleeding. Taking NSAIDs and aspirin only when necessary. Quitting alcohol. Quitting tobacco. Avoid exposure to second-hand smoke. Managing any existing GI conditions like diverticulosis. Treating causes of ulcers like Helicobacter pylori infections. And getting screened for colon cancer can also reduce your risk of GI bleeding. This test can detect colon polyps and remove them before they turn into colon cancer. Please like, share and subscribe to Expert Medical Coding. Thanks for watching.